Hello and welcome to the Krieger Institute of Plastic Surgery. I'm Dr. Zal Krieger, Director of Patient Education. I'd like to tell you a little bit about what to expect during your initial consultation. Patients coming in for post-mastectomy breast reconstruction or even breast reconstruction after a lumpectomy defect should expect to have a very smooth and easy first visit. We really understand the fact that this is a tough time for you. It's very emotional, and there's a lot of difficult issues you're faced with, decisions you have to make, things you hadn't thought about before, and our job here is to make it as easy and as clear as possible for you. I would recommend reading the information on our website about breast reconstruction and the various reconstructive options, and also looking at the before and after photo galleries so you can get an idea of how some of the various reconstructions turn out. When you're in the office, we'll look at these pictures together again. When you arrive for your first consultation, you'll fill out paperwork, and you can speed up your initial visit by filling out some of the paperwork by downloading it directly from the website and bringing it in with you. We'll begin by going over your medical history and your breast history, focusing on previous surgeries you've had, whether you've had chemotherapy or radiation, your lymph node status, and if there's any plan for future chemotherapy or radiation. Once we've covered that, we'll begin to spend most of the visit, which can last anywhere from 30 to 60 minutes, talking about the various reconstructive options. We'll talk about an implant tissue expander reconstruction. We'll talk about one of the various abdominal flap procedures where we use your own tissue and not an implant to make a new breast. And we'll talk about a latissimus flap, which is sort of something in between where we use your own tissue, but we also still have a small implant for the extra size. If you read about these procedures, you'll understand the major differences between them, and you'll understand how each one of the various reconstructive procedures has many advantages but also several disadvantages. And so we'll spend a lot of time looking at your individual needs and goals, your anatomy, your body, and what options are available and desirable for you. You may not make up your mind after the first visit, and many patients require a second or even a third visit to decide what they want to do. Some patients can't even make up their mind and keep changing it up until the day of surgery, and that's fine. It's important to realize that we're here for you to come up with the best option that suits you and your needs. At the Krieger Institute of Plastic Surgery, we perform every type of breast reconstruction, ranging from placing tissue expanders alone to the complex microsurgical breast reconstructions such as a DIEP or SIEA flap. And you can read more about these on the website. All the options are available for you based on your goals and your anatomy. Once you're done with your visit, my office will then coordinate the surgery and the scheduling with the office of your breast surgeon, the one who will be doing your cancer surgery. We will also obtain any insurance authorization that is required before surgery. So really, all you have to do is pick the reconstruction that is best for you and find a date that works well for you. In general, for the simpler reconstructions, women need a week off of work, and for the larger reconstructions, the one that use your own tummy tissue, 2 to 4 weeks off of work are adequate. I hope to see you in the office. If you have any other questions prior to your visit, please don't hesitate to call us or email us, and I